How many of you sleep with some form of a light on? That can dramatically affect how good of a sleep you get and how long of a sleep you get. Sleeping is pretty much defined as your body getting energized and rejuvenating for the next day. Your biological clock or circadian rhythm responds to how long you've been awake. So the melatonin is a hormone that is released when you lay down and go to sleep at night. Well, if the room is not completely dark, the hormone is not released all the way. Therefore, it's hard time falling asleep or even staying asleep. According to the National Sleep Foundation, we have 3 stages of sleep. Stage N1 is the stage of sleep where you're not fully even into sleep. It only lasts about 5 minutes, and your eyes move slowly, and so do your muscles, and you are easily awake. You can easily become awake. The stage N2 is your true sleep. This is where you actually fall asleep and you can stay asleep. This lasts 10 to 25 minutes. Your eyes stop moving and your heartbeat slows down, and so does your body temperature. Stage N3 is your deepest part of sleep. Your brain waves move extremely slow, and your blood flow is directed towards your muscle, which restores energy. And then we have a stage called REM sleep, which is repetitive eye movement stage. This is the stage where you dream. Your heart rate and blood pressure rise, and your legs and arms are completely paralyzed during this stage of sleep. And now I'm going to talk to you about the most popular kinds of sleeping disorders. Insomnia can be pretty much defined as where you just can't sleep. Either you have trouble falling asleep, staying asleep, or you wake up super early and you can't go back to sleep. And the next day you feel groggy or irritated. This mostly is caused by stress, anxiety, certain medicines that make you this way, or alcohol and drug use. Probably the treatment for this would be cognitive behavior therapy, and they find where distress is located to make you not sleep. Sleeping tablets can be prescribed, but it doesn't cure insomnia. Avoid caffeine and heavy meals at night and block out any kind of light because, like I said, your body can't release the melatonin properly, so you can't fall asleep. The next one is restless leg syndrome, and this is where you have uncomfortable sensations going through your legs and sometimes even your arms. This is caused by just probably being passed down genetically. There's no really root cause of it, just it's been passed down. I know my mom has restless leg syndrome, and so does my great-grandma, and they describe it as they feel like pins and needles are going through their legs, and they have to get up and walk to get the sensation to go away. And this mostly happens at night when they're at rest trying to sleep. For mild restless leg syndrome, they say to perform leg exercises and find a regular sleep pattern, and also decrease the caffeine level, alcohol, and tobacco use. And different medications can help, but sometimes the symptoms affect different ways. So if it could take away the symptoms in this person and then again make the symptoms worse. And for home remedies, you could do leg massages, heating pads, vibrating pads, but there is no cure for restless leg syndrome. Sleepwalking. Sleepwalking is where you walk in your sleep or you just do different kinds of behaviors. Usually children suffer for this most, but it can happen in adults. For children, usually they scream and they're known to urinate in closets. And this happens from 3 to 7 years old. And most likely your child will be a sleepwalker if they are a bedwetter. In adults, this can happen if they're sleep deprived, if they're stressed, or if certain kind of medicines affect the way they sleep. Most children will grow out of this, but if adults have it, they usually prescribe medications such as antidepressants. According to the Sleeping Disorders and Solutions, make sure your house is clear of anything that can cause harm, because the worst thing you can do to a sleepwalker is to try to wake them up, because they're sometimes going to act aggressive. So they suggest you put things on the corners so they don't bump their heads, or make sure anything that could break is put away. Night terrors are where they have extreme fear in the middle. They wake up in extreme fear in the middle of the night. There is sleep terrors and night terrors. Sleep terrors happen at the beginning of this first part of sleep, and then night terrors happen the second part when you're deepest part of sleep. According to the Mayo Clinic, some of the causes include sleep deprivation, stress, lights being on in the room, overfull bladder, different medications, restless leg syndrome, and head injuries. I know that when I was little, my mom said I had night terrors. And what I would do, which is most of the symptoms, is you sit up and your eyes are wide and you start screaming and crying and you start acting aggressively. And she would come and hold me, but you can't wake a night terror, someone who's having a night terror up, because it freaks them out more. So the best thing you can do is hold someone who's having a night terror and make sure they don't harm themselves. And if adults have night terrors, it mostly runs in the family, or if they have a history of depression or anxiety. Children will probably grow out of it. And if you don't grow out of it, they have sleep studies and meds, and they'll check your stress level to see what's causing you to have night terrors. Sleep is really important. It can cause a lot of health issues. Sleep deficiency is linked to heart disease, kidney disease, high blood pressure, diabetes, and even stroke. It can also be related to obesity. Sleep and metabolism are controlled by the same sector of the brain. When you are sleepy, certain hormones go up in your blood, and these same hormones drive appetite. So that can kind of relate to the munchies or whatever, because you're sleepy, and also that same hormone that's released, you're sleepy, the same hormone that's released to say, I'm hungry. So, sleep is really important. And with that all being said, I'm so good at sleep, I can do it with my eyes closed. Thank you.